Hello, I'm Cami Tynan, a clinical dietitian with UCHealth. In this video, I'll walk you through what you need to know about diet advancement and first meals after transplant. After your transplant surgery, it's important to keep your nutrition up to support healing and recovery. We encourage patients to start slowly, testing a clear liquid diet first to help restore bowel function after being under anesthesia. Once you start eating solid foods, remember to keep taking it slowly for the first 24 hours. If you feel there's any significant bloating with nausea, stop eating and inform your medical team. We recommend lower fat foods to start off with, so consider oatmeal, cream of wheat, or a cheese and egg omelet as your first meal. As you tolerate that, you can start focusing on adding high protein foods like meat, eggs, cheese, and yogurts. You can also drink milk if you tolerate it. Other foods you can consider include nuts, beans, cottage cheese, and softer meats like fish and pot roast. If you're struggling to eat full meals, you can also supplement your diet with snacks and protein shakes to make sure you're getting enough calories and protein for healing. You'll follow this eating pattern of small, frequent meals for the first 2 or 3 days post-surgery. Then, as you're able to tolerate normal food, you'll increase your meal size over the next 10 days. Again, it is important to not overdo it. If you feel any significant discomfort or nausea, stop eating and inform your medical team. As always, we're here to answer any questions you might have. To learn more, visit uchealth.org/transplant.